Our first guest this morning is ready to make sure you are SPF. This summer, a solid 10. I mean, super perfect figure for SPF. Dr. Andrew Wolfe with the Center for Cosmetic Surgery offers a mix of innovative and traditional methods. He takes the time with each patient to make sure they feel comfortable with any cosmetic procedure. Today, Dr. Wolfe's focus is on a treatment that will have you soaking in the SPF, talking about super perfect figure. Dr. Andrew Wolfe is joining us now. Nice to see you, my friend.
Good morning.
So let's talk about your approach, your overall different approach to fat reduction. Why do you believe in CoolSculpting?
Well, as a surgeon, we've got a variety of different surgical options to treat excess fat in the body, and we've, as a practice, I think, been skeptical of some of these non-invasive methods. CoolSculpting is the first one to really show up on our radar as an FDA-cleared device for permanently removing fat from unwanted areas in the body. So
it's nice. I mean, as a surgeon, this fits up to your caliber. You're absolutely saying, okay, I'll take this into my practice. It works. It works, absolutely.
And if we're going to use this as a treatment, I've got to be able to confidently tell a patient this is something that's going to deliver you a safe, predictable result. And CoolSculpting has done that. So we've been very excited about it.
And what happens to the fat? How exactly does CoolSculpting work?
Well, CoolSculpting works by selectively freezing fat cells. It leaves the skin and the surrounding tissues unharmed, but it can selectively freeze fat cells. Your body excretes those fat cells as they deteriorate, really in a harmless fashion.
So when you meet with a possible CoolSculpting patient, what's your consultation process like?
Well, we've got an arm of our practice dedicated to CoolSculpting. So we've got nurses who actually perform the procedure, and some of these patients will meet in consultation with me for body contouring procedures, and I may tell them that they're an excellent candidate for surgery. For a lot of these patients, CoolSculpting is actually a very viable alternative, and so they'll end up with the nurses that way. Sometimes they'll find us through different websites like CoolSculpting.com, but they will come in and meet with the nursing staff, be evaluated to see if they're good candidates.
Right, and again, you can go to CoolSculpting.com. If you directly want to talk to Dr. Wolfe, you can go to 303-278-2600. His number again is 303-278-2600. Mention Colorado and Company, and you'll get that great deal. And going on to the consultation, the CoolSculpting part, you actually mark areas on the body, right?
Exactly. So patients will come in with particular areas of concern, and CoolSculpting is cleared for the abdomen, the flank or love handle area, and then the inner and outer thighs. And based on the patient's concerns, based on how they're built, there are templates that will be applied for the various applicators, and we can mark out the areas of treatment. The gel pad is applied to the fat areas to increase the conduction of the cold, and then the applicator is applied and slowly chills the fat.
No downtime. That's a huge plus, too. It's non-invasive, and you can have your SPF this summer, a solid 10. Super perfect figure when you call Dr. Wolfe, 303-278-2600. There's a free consultation. Just mention Colorado and Company. The number again, 303-278-2600. We had a chance to talk to one of your patients, a CoolSculpting patient. Let's take a listen.
I've absolutely worn clothing to cover up problem areas or trick you, camouflage areas that were problematic. The results that I desired from CoolSculpting were that I could feel more comfortable in my own body, that I would look better in clothing, that I wouldn't have to necessarily camouflage my flaws anymore. I decided to try CoolSculpting on my thighs because for me, I'm bottom heavy, and that seems to be a trouble area for me, so I figured if this could help, why not go for it?
Boy, she's beautiful.
Lovely.
It's good that she came in and she feels more confident about herself. As a patient, what are they doing during the CoolSculpting treatment?
Well, what would you do if I sat you down and forced you to relax for 3 hours
I would take advantage of it.
But you can read a book. People catch up on Facebook. So I have diligent patients who will work throughout the entire process. Right. I would take a nap.
Yeah, and you could also watch a movie maybe on your
Absolutely.
iPhone. It's really relaxing. And you brought in some pictures of CoolSculpting patients that you have, Dr. Wolfe. Let's look at the transformations and tell me what you did here.
Got it. So this is a woman who came in primarily concerned with the central fat in her abdomen. And so she had what is essentially a diamond-shaped pattern of 2 small applicators at the top, 2 at the bottom, a single session, and this is her 2 months after her treatment with a pretty significant reduction in fat.
Wow.
This woman, similar concerns. She had a large applicator across the bottom and then 2 on those small upper abdomen areas, and those were reduced significantly well. And this is just the bra roll, so it can be a very focal treatment where she had 2 different sessions, and this is her post-op photo at 3 months.
And I want to point out, this is for men too. So if you want those six-pack abs back, this is the way that they can cool sculpt those abs back for you too. And talk more about the science behind CoolSculpting. Why is it so effective?
So this is the first cool-based therapy to really focally address fat. And so it's been known for a long time that fat cells don't tolerate cold. Zeltiq licensed this technology from some Harvard scientists and applied it to the CoolSculpting device. And so we can selectively target fat cells, freeze them, and then the body excretes them over a period of several months.
CoolSculpting is one of the most popular treatments right now. Why do you think it's so popular?
Well, if you talk to any personal trainer, they'll tell you you can't spot reduce. And so doing crunches works great for your abs, but it doesn't focus on the fat of the abdomen. So now we've got a non-surgical option for spot reducing these fatty collections.
That's why I actually had CoolSculpting done on the outer part of my hips and thighs, because you can't spot reduce, and that's where I gained my weight right there. And what are the typical results that patients see?
So typically you're going to start to see results around 3 weeks after the procedure, 3 to 4 weeks. Maximum results are typically seen by about 3 months, although it may continue to improve for a while after that.
Okay, and it's also important to you that this was all developed by Harvard scientists.
Well, the basic science surrounding this is very, very strong. And so I think if you're going to look at a technology, you want to try to figure out what's the basic science, what's the clinical application, and this is something where both of those sides are very, very strong. There's animal studies, there's clinical studies that show both in terms of ultrasound and photographs, some really significant reduction, 20 to 25% of fat in a given area.
I know everybody at home is probably thinking, okay, but what about maintenance? Do I have to do follow-ups?
Well, this is the kind of thing where you could come back and repeat the treatment on a given area if you didn't get quite as much reduction in fat as you would like, so that's something you can absolutely do. Otherwise, we just encourage patients to watch their diet, eat well, maintain exercise, and that's essentially all you'll need to do.
Well, thank you for coming on the show. And by the way, it's so funny, when he sat down, I've never met him before, but you actually did a procedure on my next door neighbor, and she speaks so highly of you.
Good.
So excellent, yeah. As you heard it in the beginning, I'll say it again, it makes sense to make sure your SPF this summer is a solid 10. And by SPF, I mean super perfect figure. Dr. Andrew Wolfe is ready to help you accomplish that goal. His consultation is free. And for the first 20 people who book their consultation at the Center for Cosmetic Surgery, located in Cherry Creek, you're going to receive a special discount on your procedure. The number to call, 303-278-2600. That's 303-278-2600. For more information about what you saw today, you can go to CoolSculpting.com, and they paid for today's segment.